Chapter 2, Workforce Safety and Wellness. We're going to be talking about the safety of the EMS worker as well as the wellness. Medicine applies to the fundamental knowledge to provide basic emergency care and transport based on the assessment that you find of the acute ill patient. Acute means at that moment, chronic means long term. You may go to a patient that you have to go back to more than once because they have a chronic condition like heart disease or COPD, and you constantly go to them. That's called a chronic patient. Acutely means it happened at that moment or within a few minutes. Infectious diseases is an awareness of how to decontaminate equipment after you treat a patient, how to also decontaminate the truck and all the equipment that you used for that patient that you might use again. Preparatory applies to the fundamental knowledge of the EMS system, the safety and the well-being of the EMT, medical and legal ethical issues to the provision of emergency care. Workforce safety and wellness. Standard safety precautions, PPE equipment, stress management, dealing with the death and dying, and prevention of response-related injuries. National EMS education standards is what we're talking about. Introduction is to take care of others, we must take care of ourselves. EMT training includes recognition of hazards, personal neglect, environmental and human-made threats, mental and physical stress. Wellness is the state of complete mental, physical, and social well-being. A state of wellness must occur at work and at home. So if you're not well and you're sick and you go to work, you push yourself to go to work, you come back home after your shift, you rest, you feel a little bit better, but you're still not well, it will eventually catch up with you. EMS is very, very, very unpredictable. So you don't know if you're going to be busy the whole shift or if you're going to, you can rest some, or you're going to have to be back-to-back calls. So it's very, very important that you take care of yourself. Components of wellness is protection from the diseases and hazards. You want to make sure you eat proper nutrition. Make sure you're exercising, getting enough sleep, and of course refraining from things that can cause interruption in your sleep, interruption in the body's process to heal its natural self, which would cause some of that would be tobacco, drugs, and alcohol. Taking time to relax. EMTs often work in stressful situations. They need to be, their role, they have to be prepared. You have to anticipate resources needed. You need to control the scene and care for the patient. Your calm manner will calm the patient, the family members, and the bystanders. Stress in any event, thought or action perceived as a threat. Stress is any event, thought, or action perceived as a threat. So I could talk to you harshly, and that can be mistaken as, stress, or someone put their finger in your face and said, I'm not going with you, called you names, and then all of a sudden they collapse in the floor and they've become unconscious and you take them to the hospital. That's going to be a stressful situation because you didn't know how to perceive the patient and then they collapsed on you. Regardless of how stressful the situation, you must focus on this order: personal safety, scene safety, and patient care. So if there's nobody in the house and this patient goes unconscious, make sure there's LEO there, and then when they become unconscious, take them to the hospital. If not, you need to get the officer to help you get a release of, they're signing a piece of paper they don't want to be transported, but if they become unconscious, then you need to transport them. Stress can play crazy things on the body. Minimize and eliminate stressors, change partners to avoid negative and hostile personalities, change work hours. So if you work nights and an opening comes up on day shift and you really, really want it, then you put in for it. Change the work environment, cut back on the overtime. If you're working 20 to 60 hours overtime a week, you're going to get burned out, so you need to cut back and relax and take care of yourself. Change your attitude about the stressor. Talk about your feelings. Seek professional counseling. Do not obsess over frustrating situations and try to adopt a relaxed physiological outlook. If there's something going on with you and you really do need to seek counseling, you can always go out on your own. The insurance you have with the state will pay for it. And it's very, very, it's between you and them and your insurance files. It has nothing to do with your job as far as them wanting to find out and, be in your business. Some people don't want anybody in their business, so go get you some help and take care of it. Expand your social support system, develop friends and interests, minimize the physical response to stress. Go to the local yoga place and yoga. There's Zumba. Practice deep breathing, regular exercises on a daily basis. Mediation and limit your intake of caffeine, alcohol, and tobacco. I believe we did this same thing before. Sometimes you may have to let go of people you really love and just take a break from them. All right, wellness and stress management, nutrition, exercise, and sleep, regular, uninterrupted. So if you're not sleeping good at home and you run calls all day at work and you don't get a chance to rest, you're going to go home and exhausted. So you go to bed early, get you some sleep so you're ready for the next shift the next day. If you work nights and you're interrupted during the day sleeping, that's going to be a problem. So you need to figure out how you can resolve that as well. Disease prevention, know your family's history, health history, adjust your lifestyle, balance work, family, and health, rotate your schedule. If you're single, some of this is like, oh, I don't have that problem because I'm single. But some of you may be newly married and your wife will work the opposite shift of what you do, so you don't see each other as much, and that might be stressful, or you might like it when you get married. Or maybe mom and dad is home and you're trying to study and there's noise. Maybe you can go outside and study. Just, take care of yourself. Infectious diseases caused by organisms in the body. Communicable diseases can spread from person to person and from species to another. That's what we're seeing with this COVID. Infectious risk can be minimized by immunizations, PPEs, or protective techniques. Hand washing is the number one way to prevent the spread of diseases. Also, wearing a mask. People are breathing and coughing and sneezing. Sneezing can go up to 3 feet away from you. So that's why it's important to have a mask on. Pathogens, contamination, and exposure. Routes of transmission. How does that pathogen get to someone? Direct contact, indirect contact, airborne, foodborne, and vector. So if you've ever had food poisoning, like the foodborne transmission, uh, food poisoning is awful. I had it, my son had it one time. We went to Golden Corral years ago in Wilmington, and we both ate the same thing that the other three did not, and we got sick. We were so sick. All right. And these routes of transmission, you can see where there's an infection with the finger. It's red, it's swollen. It may even be warm to touch and may be painful to touch. So those are definitely signs of infection. The guy to the right is sneezing, and remember I just said that can go up to 3 feet away from the patient, so he needs to cover his mouth. Risk reduction and prevention of infectious and communicable diseases. All EMTs are trained in handling bloodborne pathogens. CDC's developed standard precautions such as hand hygiene, PPE such as gloves, gown, mask, eye, and face mask are very important to wear. The continuum of this risk reduction: patient's care environment, soiled patient care equipment, environmental controls, textiles and laundry, needles and other sharps. Hand washing, simplest yet most effective way to control disease transmission. Wash before and after the patient, even if you're wearing gloves. So if you put on gloves, you get to the patient, you got your gloves on. When you get ready to take those gloves off, you want to make sure you wash your hands. Very, very important. Wear gloves if there are any possibility exposure to blood and body fluids. Urine, feces, spit, vomit, arterial blood squirting. Vinyl, nitrate, and latex gloves are effective protection. Make sure you wear them. Eye protection, prescription glasses are not adequate. You must have goggles and a face shield. Provide protection from extensive blood splatter. May not be practical in many situations and may even pose a risk for injury. Standard surgical mask for fluid splatter. This is an N95 mask. These masks and EMS are fitted to the worker. They will blow content up to see if you can smell it underneath or around the mask. And if you don't, then that's a proper fit. If it is, if you do smell it, then they're going to have to change mask and fit another one. Mouth-to-mouth resuscitation and transmission of disease. You want to get you a CPR mask with a one-way valve. It's very important. We can use the pocket mask here as you see it. It has a one-way valve on it. The bag valve mask, we use that in CPR. Dispose of these devices according to the guidelines. So if you use them once and you have a one-way valve on it, you got to take that valve off and throw it away. I probably would end up throwing my mask away unless, especially if there's a filter in there. Proper disposal helps avoid HIV and hepatitis. Do not recap needles ever. If they break or bend, there's a proper way to clean them up off the floor. Dispose of sharp items in an approved closed container. This is an approved one. It's ones that we use on a daily basis. No guarantee of 100% risk-free environment in EMS. Risk of exposure to communicable diseases is a hazard of the job. Know your department's infection control and plan and follow it. When people don't follow it, that's when they get in trouble. You want to wear your gloves. You want to make sure that you wear whatever your plan tells you to wear for whatever situation. Infection control should be part of your daily routine. Clean the truck after each run. Cleaning should be done at the hospital whenever possible. As soon as you're done with that patient, you should have your partner start cleaning while you do the paperwork. Even if germs reach you, you may not become infected. You may be immune. Remember, you could be a host and you could transport that to someone else. Preventative measures: maintain your personal health and make sure you are up to date on your immunizations. General post-exposure management. If you're exposed and you've done everything correctly, you wore the gloves, partner left a needle somewhere while you were cleaning, you didn't see it and you got stuck. It's very, very important to immediately tell your partner so that you guys can figure out which patient you just had. Make sure you let your supervisor know immediately. And after that, you also have to let your teacher know, because I have paperwork to do as well. If rinse your eyes, if fluids splash up in your eyes, you do that for 20 minutes. Activate your department's infection control plan and complete an exposure report. Begin protecting yourself. Continue to protect yourself on scene. All right, seeing hazards, 1 of 4. Hazardous materials can be identified what you can from a distance. Do not enter unless it's safe to do so. This book is an emergency response guidebook. Emergency management usually has it in our county, and you can get a copy of it, and I'll get some copies. And each one of those placards tells you something about the chemical that's on that truck or what you're, getting called to. And it'll have everything in that book to let you know the hazards of that material, the hazardous materials. And don't enter unless you're safe to do so. The fire department will let you know when it's safe.